Hi, everyone. Want to welcome you to this week's edition of VBC One One Take in studio today. I'm really excited to hear his story. We have Rod Kersch, who is Vice President of Health Plan Development with WEX. But what you may or may not know, and what we're going to talk about today, is that he's also known as the camper guy. Rod, I'm going to let you tell us a little bit more about that. Why do they call you the camper guy?
Great story and great background to that, Shannon. Yeah, let's talk about the why. The why this came about was I was privileged in from 2015 to 2020, 21 to be part of a lot of the first healthy foods program that I worked with Humana on developing, the first flex card in the market with Alignment Health, the first multi-purpose retail mail order card and program available out there with Anthem Elevon. So I got to be a lot of the first. And that those were always developed with me and other executives sitting around the table, deciding what members needed. But the thing that was missing at the table was the member. And in 2020, during the pandemic, what's funny is my wife and I were sitting around the TV watching the nightly news with David Muir, and he came on with an article, a session about how Streamline had almost went under, a camper developer. But going into the pandemic and coming out, they actually tripled their business. They had to double their manufacturing space. Everybody started living, traveling through the camper and campsite lifestyle, and especially seniors. And I turned to my wife and she said, I've always talked about wanting to get members' perspective. I want to buy a pickup in the camper. And being a guy that's never camped a day in my life, after my wife had done laughing and thinking I had a stroke and convincing her I hadn't, we bought a camper and a pickup. And for 3 years, that's what I've got to do. I've got to travel the country, pull into campsites around the country, and I walk around. I've got little cards made up. I've got banners that I set up around that invite people over to a campsite and just let them talk. What's the good, bad, and ugly of their Medicare, Medicaid lives? And not even that. Some of my better stories are just our seniors are really our golden people. What they did and what they went through to give us the lives we've had today are tremendous. I've got great stories from people that fought in World War II and Vietnam and went through some heavy depression and recession eras and life challenges. It's been life-changing for me. It's become my addiction. I'm not a golfer. I don't have a lot of other hobbies, and it's not only become my hobby, but my passion. So I've been able to gather this data, and I want to turn it into really giving these seniors what they're looking for in their retirement years.
I love this, and I can't wait to get into some of these stories. Why don't we start with, so you bought this camper, you're out on the road, you pull into the first campground. Take us through, how did this start? How do you get to know people so that they open up and share their stories with you?
So it was interesting, and I've got great pictures that I share with a lot of people. And the first great picture I have is my camper literally pulling into one of the first campsites. I had a little 12 by 12 inch sign made up that just said, you want to talk about Medicare, stop by my campsite. And I literally would tape that to the front of my camper. And a few people started to show up, but then I started walking the campsite and just saying, hey, free beer, beverages, why don't you sit up here, just talk. I'm actually in the Medicare business trying to develop a better Medicare program. And I'd ask people, are you on Medicare anything? And a lot of them that I was able to judge were. And they started coming by the campsite. And of course, the first conversations that start are about their life or about their kids or about fighting in World War II. And then it would get to, now you're retired. How is your health care taken care of you? How is Medicare? How did you sign up for it? What did you sign up for? And the conversations got better. My questioning and research got better and more efficient. And of course, the advertising got better. Now today I've got nice big formal signs that I put at the front of the campsites I go to and in front of my camper. I've got postcards that I run around the campsite and hand out to people that stop by this campsite number to have a free beer or beverage and talk about life. And now I'm starting to get 8, 10, 12, 14 people a night at my campsite, and a little more formal and more organized. But it all started with a little 12 by 12 sign and walk around the campsite and see if I can get some people to the campfire. When it started working, I just kept going and kept obviously improving how I did it.
What did they want to tell you about Medicare? I know you said about the families, and you've shared with me some of the great stories. And so I'm going to have you introduce to us some of the folks that you've met over your career of doing this. But when it came to Medicare, what is it that they wanted to tell you? And then has that evolved over time? Because you said you got better at the questioning. So just curious, what was it that they drove them to come and gave them the motivation to come to your campsite at night and tell you? What did they want to tell you about their Medicare and their healthcare experience?
I think why I'm so solid on this campfire thing and why I believe the data is so pure and good is because I think it allowed people to drop their curtains and inhibitions. And what they came over and wanted to talk about was Medicare scared them. They were intimidated by it. They felt it was very confusing. Of course, a lot of different opinions, but the government or the health plan always got the hammering for they're making it difficult for a reason. And I will tell you, Shannon, what I found shocking in the beginning of this was it was amazing to me in a Cliff Notes how many people would come up and say, what'd you sign up for? I signed up for such and such. How was that plan working for you? And I can look at my notes, like over 82% said that their plan is not giving them exactly what they thought it would. Okay, it's a lot. That 82% didn't get what they thought they were getting. So you signed up for this plan. Why did you sign up for it? That's what my broker or my agent recommended or a friend. That's what they're on. So I just was so confusing. I just went with their advice type of deal. And then I get to the last question. Okay, so what do you think of your broker or agent? Which over 80% were using a broker to sign up or an agent.
Yeah.
And they would say, I love them. 90-some% had a satisfactory, above satisfactory rating for their broker. So they signed up for something they were not totally happy with, but they're happy with their broker who basically recommended them put it in it. So there's a disconnect there. And so what started it started when I said I've gotten better at this. I started having to figure out how do I get them to open up about, okay, they love their broker. Why do they still love their broker when they're unhappy with their plan?
Yeah.
And throw me down some different avenues of stretching the questioning. Why? What did the broker do that you still like them? Why do you like them? Most of them like them because they've known them for years, or they're a friend, or they just talk so educated about Medicare that they just appreciated their value. And we all know anybody that's been in sales is somewhat guided by the monetary piece of it. So they had somebody that was probably I'm not going to throw any stones, but probably worried about their home economics and what's best for it, helping somebody decide for them based on their home economics. So they weren't putting them in. That's why we have so many people in Medicare Advantage that probably shouldn't be there.
So much there to unpack. And I think that's great. A few things that I've noticed in just what you're sharing is that obviously connection is important and having that rapport. And for leaders that are out there listening, there's an opportunity probably to work with brokers to better educate them on where they should be directing members so that they are not only having that great relationship, they're getting the health care and the things they need. But that last bit that you said about maybe they shouldn't be on Medicare Advantage. I've been in Medicare Advantage for 20 some odd years. I think the benefits are great and how there's so much to offer in those plans and the way they're designed and done. But curious, because agree with you. I think that there's different plans that are necessary or are better suited for our members. And so talk a little bit about that. Where did you think that they should be? Or where do you think they should be? What would be better for them? Why not Medicare Advantage?
And keep in mind, Shannon, when I make that comment, I will be frank. At the start of this conversation, I talked about how I got to be a part of a lot of the first benefits that are out there. Those are Medicare Advantage. You don't get those unless you're on Medicare Advantage or some type of SNP plan. My livelihood is dependent on Medicare Advantage. But I think there's some people that demographically, geographically, because Medicare Advantage paid a higher commission, a lot of these agents out there signed them up for it to help their own pocketbook. And they should have never been on. But I believe in Medicare Advantage. I think there's a whole lot of people that will benefit financially, health-related wise, all that, to a point where I am a heavy believer in it. But I think we need to be careful. I think we need to base it based on where that person's. One of the major things I found, a lot of people ask me, what are some of the major things, your takeaways after 3 years of doing this? One of the biggest things I take away is we have to get the member more educated and involved in the decision. When you retire, you go to your financial planner to have them figure out how you're going to live in this retirement world on a fixed income. That's a big financial decision, but probably just as big as your health care. It can end up costing you more financially than your investment decisions. So we need to get people more involved in their decision. But even more importantly than that, what I found is, and I think we as an industry have to start to take into consideration, Medicare Advantage is great. And especially for a lot of the younger generation that's moving into the baby boomers that are moving into the Medicare Advantage age. And what I found is we look at everybody, we rate people as a baby and an infant and a young adult and a middle-aged adult. And then all of a sudden you hit 65 and you're a senior. And whether it's in government, agency, plan, program, whatever, all of a sudden you're a senior and we're managing you as one. And I've easily been able to segment, we need to change this and put people in the stages of retirement. People 65 to 72, a good majority of them, over half that I'm interviewing, are still working. And they sure in the heck don't consider themselves a senior in the fact that they're still active. They want to play pickleball. They play cards. They're very active in their social life. They're out dancing. They're reading their books. They're doing all this stuff. They're active as they were the previous 65 years of their life. They just need peripheral type support. And that's where we get into some of the benefits stuff. Found out people 65 to 72, vision and hearing and some of that stuff's more important. If you get to 72 to 80, the body's starting to break down. I can tell, my numbers show it. And they're starting to look more towards pharmaceutical to manage it. After 80, body's really breaking down. Those people are in a healthcare regimen. I've got doctor's appointments every month. I've got a pill regimen every day. I've got surgery scheduled. Healthcare really has taken over their day-to-day lives after about 80, but we need to segment them. And as we segment them, I think that will help us in where should they be, whether it be traditional Medicare with the gap plan, Medicare Advantage. I think that'll help.
That is a brilliant observation. And I've never heard anyone, except for you, say that. As far as looking at age, we talk about diseases, we talk about cultural differences, and whether or not someone lives in our urban centers versus a rural area. But no one's ever talked about thinking about and stratifying or segmenting, right, the population by looking at where they are in their retirement journey. A couple of things, and again, I want to get to those stories and hear more about even the stories maybe along those segmentations. But you mentioned about brokers being compensated, and no, being in the industry, both of us, for as long as we have stories to tell. But I know that there were some recent changes around compensation and that the government has looked at this and they've tried to put measures in place to control for members being put in plans that would serve them. What do you think about those? Do you think that offers any promise? Some of those things are relatively new. We just had them right over the summer of last year of 25 and even in 24. Do you think that any of those hold any promise to maybe make some change and get folks to the right plans that they should be a part of?
I think the good things, I'm always for people, if they do the right thing, making as much money as they possibly can. I'm for the capitalism on that side of it. Yeah. And with the broker increases that the government allowed and increased this past year, double digits this last year is very good. I think that's a good thing. Now, I will back up and digress in that in 21, my position where I developed all this stuff was eliminated due to they were a gift card company and the pandemic hit them hard and they closed down our offices and moved them all back to corporate and eventually got to me. When they did, I started my own consulting business. And one of the first engagements I had was with a plan that wanted me to look at, they were paying 38%, I think, of their overall revenue was shared with the broker. And they wanted to see how they could cut some of those expenses out. And so I went into it thinking, oh, yeah, I'm not a huge broker agent fan. Yeah, let's, I'll do some research. And as I got into it and as my own research started to accumulate, and I told you the numbers, how many used a broker and love their broker, and how education was a big problem, I've changed my opinion. I'm getting to why I think the financial piece of it plays. And that is, in anything you do, building trust with somebody is the quickest way to help them listen to you take your advice, move the education needle forward. And brokers already have that trust built with the members out there. 80 some percent like their brokers. So the trust is already there. What we need to do is make sure these financial parameters help get the member involved. They've got the trust. Now they've got to do the right thing with that trust with the members. So I believe that the increases are good, but I think the bullet points need to be very specific. And I think they need to be more tied to educating the member and getting them in the right plan. I think that's part of our financial problem is some of these members are just in the wrong plan.
Interesting. I would love to get into some of the stories. Maybe we could start off with, before I keep holding it back because I know this is the good stuff. Curious to know what has been maybe your favorite region, or maybe you said you've been all over. Maybe give us a sampling. Where have you been? What areas of the United States? And then maybe what was your favorite for your campfire stories and why?
Yeah. And just so I keep very busy during the warmer months. I'm out of Omaha, Nebraska. So a lot of my time, I try to stay out as many weeks during the spring, summer, and fall as I can. And in doing so and keeping my wife happy, there's a major interstate corridor that goes all across the country, east to west, with I-90, I-70, I-80, that runs through upper part of the Midwest, the central part of the, so a lot of times I'd be running up to St. Louis off of I-70 in Kansas City and out west in Kansas, Montana. But I always take 2 or 3 big trips every year. Like this last year, I went up through Colorado, into Utah, around into Idaho, Montana, back around. We take a 2 or 3 week trip early in the season and late in the season. So I've been all over. The nice thing though is like when I get up off I-60, I'll go up there a lot during the summer. And you're catching all those vacationers going to Mount Rushmore and going to off I-60. So I'll go up there and set up and catch everybody pulling in and out. So I get an array, and I've gotten some people have said, I'm not sure you're getting the good demographics of people. I debate all the time. I've talked to people that walk out of a camper that they hand painted. And I've talked to people that walked out of an 800,000 motorhome that's got more trinkets and more lavish than most people's homes. So I think I've hit them all. But there is one story. I've got lots of stories. And this is the part that's changed my life. Obviously, being able to bring data to the table and help people understand what the members are really, what's happening in their life, what they're really looking for is important. But one of the big things that I can tell you too, is after 3.5 years of watching people walk up to my campsite, walking around campsite and see people move around, I can pretty much point to somebody and tell you they're either socially isolated or they're not. Social isolation, you can tell, has health-wise hampered a lot of individuals. And one of the greatest stories I have is a gentleman named George Murray Meller. I was up in Missouri over by St. Louis. Actually, I was in Illinois at the time. And he and his daughter came over to my campsite. And George was 98 years old. And he had been out walking the campsite and telling people to stop over. Well, he and his daughter did. And George and his daughter came up to the campsite, and he was in a walker and shuffled up to the chair. There were 6 or 8 of us, and we sat there, and George was a little slow to get started, but then he started telling us about himself. And George was 98. He was one of the last P-51 pilots from World War II. And they had this big war reunion every year, and it started 50-some years ago. And he and his wife would take a 2-week camping trip, and they'd end up with the reunion and then go home. His wife passed away 8 years prior to this, and his daughter took over and chauffeured him to this camping trip and into his camp, to his reunion. And it was amazing. The first night George told several war stories. And then the next day I was walking around the campsite, and his daughter came up to me and said, "Hey, are you going to do that again tonight?" "Yep, I sure am. Be careful if my dad comes." So I bring my dad. "Please do." George didn't come with a walker. George came with a little cane. Now, he didn't run up to a seat and sit down, but he would walk with the cane. He didn't come with his walker. And he was just vibrant. George was full of energy. You could tell it was a difference. And his stories were great. We even talked a little bit about how Medicare was taking care of him. And George shared he was 98. He wanted to reach 100. And there is a little bit of a sad part of this story. But when they left that night, I was almost in tears. His daughter came up to me and she said, "Rod, I don't know what you're trying to accomplish here, but I have not seen my dad so energetic since my mom died." And I was like, I am all in. If I can change somebody's life like that, the numbers are important, but if they're not, this is more important. But I did get a postcard from his daughter in November. George would have been 100 in January 7th of this year. He passed away November 28th or something like, so he missed it by 40 some days, but didn't quite make it to 100. But it's just stories like that. And that's what Shannon has driven me. And that's why I'm so passionate about. This is an amazing generation that we have out there. And so many of them tell me that they paid into Medicare for years and they just really thought it was going to be there for them. It wasn't going to be this difficult when they retired. And I think we deserve it. We owe it to them. So anything I can do, that's why I'm willing to share my data, my story, my information with anybody, whether they compete with where I exist today in a position as a job or anything. I don't care who gets the information. If they can take it and make it a better world for our seniors, that's what I want.
I think that's amazing. And I think we lose sight, as earlier you brought up the good point about how people just get put in the 65 and older bucket, oftentimes when they become a senior, and they're looked at as that collective. And we lose sight of the individual and healthcare of all things. And we've talked about this on other episodes of this podcast. We forget about the human at the center of it. And so it should be humanizing. And it's become dehumanizing when we put folks in that proverbial bucket. I love that story about George too, though, and getting to share his story and just how empowered he became by having a voice and by having that, again, that connection. And so move from the walker to the cane. That's amazing. I would love to hear more stories like that, if you don't mind sharing, and maybe we could look at them around the segments. And again, not trying to put anyone in a bucket, but would love to hear what are the things that maybe you talked about, how the younger retirees have more of an interest in, like vision and hearing. And then once they get, 72, I think was the age you said, and pharmaceuticals, maybe you could share some stories beyond them being confused by Medicare and Medicare Advantage and the benefits, but maybe you could share some stories of the encounters and the interactions that they've had with the healthcare system so that the audience can learn, again, from you, the things that maybe they should be thinking about, whether they're part of the bid and building benefits, whether they're in a call center talking to patients, whether they're part of quality and risk programs, or they're things that we can design better so that folks hopefully can take away that snapshot, a better, clearer snapshot, if you will, of who the member is that they're serving.
Absolutely. Great question. Thank you for asking that, because there is a couple avenues that even myself, and again, going back to the start of this conversation, I talked about, and I was privileged and I feel very good about it. And I get the opportunity to puff up my chest a little bit around, I got to be a part of the very first healthy foods program out there with Humana. So as this project started, I thought I was going to be a great proponent of a healthy foods program out there, talk to people about it. And especially as I got into with some of the seniors, start having the conversation around healthy foods. And it became very clear to me that there is, and I hope a lot of the people that listen to this don't take this wrong, but because I was one that had to change my mindset, but healthy foods does have its place, but I'm not sure the way we're trying to force it in the senior area is the right position, because 82% of the people I've talked to in the last 3.5 years said they're not really going to change their lifestyle. A lot of them would say, yeah, we'll use a healthy foods benefit, but we're not going to continue it because it's just too expensive to continue it. Plus 77%, I'm sorry, I'm catching some of my notes right here, but 77% of the people 65 and older said that at least 2 nights a week of their social life is around some type of food activity, whether it's a buffet they go to or a bingo that they have lunch at or whatever. But a lot of their socialization is around some type of food. They're going to dinner with Bob and Nancy, or the Tuesday and Thursday they have potlucks. And so a lot of keeping them mentally and socially active is a lot of these things around lunches and dinners and meals. And so to kind of put them into a perspective of you need to eat healthy, and most of that would have to take place in your home. I'm not sure I'm fully on board with that anymore, that the money can be better spent to help these seniors. So I think that's very important, The other phase is I talk a lot about all these first again, and a lot of us in this industry with supplemental benefits start chasing every shiny object we could throw at the health plans to for the members. And what I found out is the members really are pretty happy and sold on the big four, the vision, the dental, the hearing, OTCs type stuff. So I've come to the conclusion of how do we bolster that up? How do we get more value in those programs for them where they can get the glasses they want at a lesser expense? The people, and what I found out, and another thing, Shannon, I want to make very clear to everybody that would listen to this is what we don't realize and what we need to focus more on. We hear about it in the politics. You watch Fox News or CNN, everybody's talking about people are struggling. They're having troubles making ends meet. 80% of the country's living paycheck to paycheck. And you sit down and you talk to these seniors and they're in the same boat, except their income really is capped. My Social Security is $1,200. My Social Security is $1,800. So my premium going up 50 or $80, that's a lot. But not just that, but my overall food costs went up $300 or $400 a month, and I can't make that work. So I am now I'm in the business of helping people manage and develop supplemental benefits, but we got to think outside the box. So I'm really working with other people out there to how do we develop some type of a discount and rebate program to help members stretch their dollar on every day ad, whether it's laundry detergent or soap or whatever they may need that they're buying every day of the week. Just general items, forget the supplemental benefits, forget the healthcare piece of it. How do we help them stretch their dollars? That's what they need help with right now. So that's what I'm trying to focus on is that entire senior, not just trying to focus on their Medicare Advantage or Medicare traditional and are they getting the right benefits?
That's interesting and can definitely see that being a challenge, that it really goes beyond healthcare and have been a part of a lot of conversations in the past of where does the responsibility or of healthcare lie and to what extent are there boundaries? And it's interesting because it all these other complexities, if you will, compound the challenges that they're having and influence how they take up healthcare because they're having to buy laundry detergent, like you said, or make ends meet with particular things. They're more apt to maybe not make healthful decisions. And then also, too, what you had mentioned about being entrenched. And I don't say that in a bad way, but when you've lived life for 70 some odd years, it's difficult to change. And who would want to change? Lots of interesting takeaways there. We know, and I'm going to date our episode here, but just recently, the president came out with his recommendations around healthcare. And a large component of that was working to reduce the price of drugs. And you're talking about being on a budget. And I think about hearing about seniors who either have not even the entire population where they've decided not to get a refill a prescription, or they only take half the pill because they have to make it stretch because they can't afford it. I'm curious if you heard conversations around pharmaceuticals, and then also too, if you're familiar with what came out around wanting to work on drug pricing and bring it more in line with what people can afford and what we're seeing around the world as opposed to in our country. Any thoughts there or any conversations that talk specifically about pharma, since it is such an important piece of healthcare and for people being healthier?
I made the comment, it's pretty evident to me, I can dissect people out. And after 72, pharmacy becomes a big piece of how they're managing some of their health issues. And so absolutely, people talk about the pharmacy and the challenges and the costs. So that's definitely a given. That's there. Excuse me. So the thing that I applaud the administration for seeing that it is ridiculous that you can go to European companies or Asian countries in where their costs overseas are half or third or 10% of what they are here. My big mantra and what I keep telling, my big saying is pretty simple. We have got to quit monetizing the member and memorize the member. And that goes along with everything that we do, including getting the cost of pharmacies down, whether it's Mark Cuban or Trump, that Trump RX and stuff, whatever can create a competitive nature to get these American pharmacies that have enjoyed so much revenue from charging substantial margins on their drug costs. Anything we can do to get it down. Yes, because you are right. I run into people all the time. You know what? I'm supposed to take this every day. I take it every other day because I can't afford it. You can't believe how many people I talk to about that. Even in their copays, Part D takes care of a lot of it, but it still is a big hit to them. It still costs them 80, 90, $100 a month. And some of these people that do have a chronic state, their medicines are costing thousands, which leaves them with the pay typically of 100, $200. And we don't realize, some of us don't realize how fortunate we are. $100 to some people that it's on a restricted Social Security check is big. And if we can help reduce that, we all want to talk about social determinants of health, but taking some of the stress off people and figuring out how they're going to live day to day, I think is the big thing we can do for them.
I have to pick up on what you said there, and I've never heard that, and I love it. We don't monetize. We can't monetize the members. We have to memorize them. Can you talk more about what you meant by monetize and memberize? I don't know if I'm saying that right.
You are. And very well for only hearing it once. But again, I got to be careful because I don't want to get anybody in trouble here, especially myself. But one of the things that's funny is if you've watched our industry from let's just say 2020, 2021 to today, there are 4 and 5 times the amount of startups. It doesn't matter what sector you're looking at, whether it's supplemental benefits or the CDH space or whatever within healthcare. There is a multitude of startups. And the money that these companies are getting in seed funding is unbelievable. And what's going on is they're all trying to build a certain capital valuation so they can just sell it off, make their millions, pack their bank accounts, and go in their own retirement and live happily ever after in a bucket full of gold. And I just think it's clouding the water. There's a lot of people out there just trying to make a quick buck. So it's clouding the water. B, it's created a situation where everybody's trying to get a part of that value. So is there truly value in all these being out there? I don't think there is. So I think it's raised the cost. Now everybody say it creates competition. I think it hasn't created competition that has driven price down. I think it's created competition that's driving price up because it's a monetization thing where they're trying to build as much equity or at least visible equity that they can in their company so they can spin it off, move on.
I have heard and seen that as well. Interesting. Tell me what's something that you've heard at these campfire conversations that you think folks in our industry would be surprised to hear? Maybe something that just is really, you were like, wow. And really, not that you didn't listen to every conversation, take care of this, but was there something that was said out there that really surprised you or differently that you can share with us?
This didn't surprise me.
Okay.
But it was amazing how much it was conversed about. And there's 2 things out there. Obviously, pre-authorization. I can't tell you an exact percentage because I really didn't keep track of an exact percentage, but almost everybody I talked to said that pre-authorization was a challenge in their world of getting access to healthcare. The other thing was 100% said that they despised their plan's customer service. Whether it's I go through 7 steps to get anybody, I don't get to talk to anybody live type of thing, but customer service is absolutely a detriment to our seniors. And we're doing them a disservice because rather than getting them in the right position and getting a positive customer outcome, they're just giving up because it's so frustrating.
I just came from an AI conference where we talked about how technology, not that it replaces people, I think it elevates them to work on other things, but how technology can be used in the instance of prior authorization or say call centers. And the thinking is there's great savings there, and there's a lot of startups. So you're talking about startups. There's a lot of startups that are around some of this work. And it seems like a couple of things that it needs to be fine tuned because it's not always making the right decisions, especially with prior auth. Some of the practices that have been out there, we know the government has taken a look at that as well and put some things in place to protect folks from that, where there is no prior authorization. Everything is basically denied and you have to appeal. But the other piece is, in going back to what I was saying about how AI and technology can supposedly save us money and save time by instituting all of these different things, running out of words. But really, you run the risk of losing the member, and which is more costly because if they can't get to who they need to talk to or they're frustrated, and then we want them to behave in a certain way. And I want to go back to what you were saying about trust too. We want members to call us and go to an urgent care before they go to the ER, or get their vaccines in the fall so that they don't get the flu, or stay up to date on their other vaccines, get their screenings, and so on and so forth. How can they trust us if we can't do simple things like this and provide them good customer service or have their benefits work for them when they're needed? So I think that's a interesting point and maybe not surprising, but I think eye-opening of how prevalent it is. So I'm glad that you brought that to our attention. Anything else?
Yeah.
Go ahead.
I think the biggest thing to feed off what you were saying there is you are absolutely right. And all of us in this healthcare world, I was on the provider side for 20 years. Now I've been on the payer side for 10. And what I found, we all want the member to be engaged. And we're at a precipice here where we've made things so challenging and members are distrusting that they're becoming very unengaged, which is a strong risk we run of losing them. The best thing we have is an engaged member, and they want things, and I know this sounds old school, but they want it simpler. They want it simpler to utilize. They want it simpler to access, and we've made it more difficult, I think. Or in their eyes, they definitely have. I've talked to over 3,000 people. I can't tell you how many see it that way, and they believe that it's intentional. So they do unattach and become unengaged because they believe we don't want them engaged. They believe we don't want them accessing the healthcare market. And that comes back to the monetization. In the right aspects, I'm sure they're probably right. But getting somebody engaged and involved, and so they're managed in aggressively ahead of their healthcare, is going to cost a lot less.
All right. You've already, I think, given us so much great information and dropped lots of hints and maybe even stated it outright. But I'm going to, for those of us that need the Cliff Notes version or just the wrap up, I would like to hear at least 3 things that you think that leaders can go back and do tomorrow to fix or make the healthcare system better for the members that they serve. And what would be number 1? What would be number 2, number 3? If I gave you a magic wand, there were no barriers. We don't have to think about budgets or things like that. What would be 3 things that you would say was our plan for making healthcare better for the seniors that we serve?
The first one's very simple, and that's education. Getting an education platform or position in place that the members can easily access, understand, digest, and be involved. We've got to get them involved in the decision process from the very start, from signing up. That's number 1. Number 2 would be, again, I go back to the monetization of the member. We've got to get the member involved so we're memorizing everything we do about it. And that includes, I go back to, we need to look at the member in stages. We've got to start looking at them. They're at 65. They're not truly a senior anymore. They're not somebody that in 1960 that basically was going to retire and die within 5 years. These people are active. They're very social. Their needs are much different, and they stay different for a very different period. And pharmacy has become such a big part of how we're managing healthcare that now as the body starts to break down, we have to look at that. The first stage of life, 65 to 72, we need to manage it more with, I think, into the peripheral. We'll give them as much relief as we can on vision and hearing and stuff that they want to use every day. When they hit 72, how do we change that to where we now change how we're supporting them financially, moving more of those dollars from a peripheral to a pharmacy base. And then after 80, there's nothing we can do. People are talking about healthcare costs and how some of these older people are eating a lot of that. They're already there and the body's already broken down. A lot of the cost effects are going to be there. So that we just need to live through and expect it's going to be a tough financial prospect to get them through. But the first two we can change long term. And then the last thing is I think people need to look outside the box and look at the individual as a whole. I talked about all of us need to not forget, look beyond just of what we've been assigned to do. Let's say myself, I've been assigned to look at how can I help improve supplemental benefits. I want to challenge myself to look at how can I help that member even more? How can I get a discount program or something like that in place that helps offset the members' dollars? The second thing, Shannon, over 60% of our seniors are overweight. There's studies out there that show if we can take just 17% off the average senior, there's billions of dollars to be saved in orthopedic costs. So we look at, and I'm working with WEX now, that's way outside my range. But let's develop a GLP-1 card. If we get these seniors on some type of a GLP-1, get those 17 pounds off them, we can reduce those costs. That's way beyond supplemental benefit. We got to start thinking beyond what our little world is and look at that member as a holistic piece.
I think that's really important too. I agree with everything you said. I think it's phenomenal advice, but I want to pick up on the last two pieces because it's recently been in the news too. We know that the balance program introduced the intent to make works more accessible and drive down the cost of those to learn how we did for but to be able to provide those to a greater audience. And I forget the name of it was a program. It was one of the first ones that introduced through CMRA had to do it and back doing more of a bundle, like maybe like a DRG with more of a bundle payment as far as services. Obviously, there's something there. Hearing about them, do you want to comment about those? Do you think that there's a benefit in either? Obviously, that those were areas that we need to look at. Knowing about this program, hearing folks, maybe not at the campfire, but at the health plans and others in the industry that you're speaking with, how are they receiving some of the changes and some of the programs that are being proposed?
As far as the bundling piece, I know a little bit, but not enough to try to be an expert or advising me on. The GLP-1s I've spent a lot of time on just because, frankly, I personally, within my own family, seen how GLP-1s have changed some of my family members' lives, both emotionally as well as physically. I've talked and been out there and seen the seniors, and now I've changed that value to, I believe it can help them substantially to the point where I think when I brought this up internally in my current company, they thought I was nuts. We developed now the very first go-to-market GLP-1 card that's on the market. Now, WEX, who is not supplemental benefits, now all of a sudden at our national meeting, we're hearing they're developing this for all our employer-based relationships and stuff, which is great. I think the sooner we can get this, I'm a big believer in GLP-1. I think obesity is one of the biggest problem in America, not just with seniors, but all the way down to our young kids. And if we can get that weight off them, I think it's going to change all life aspects, emotional, physical, social, all aspects of a life, mental aspects as well. So I am huge behind it. Yes, the government, some of the things they're doing around the GLP-1s and developing specific programs to create competitive natures. That's my philosophy right now. The big challenge is talking to plans and even employers is, again, their GLP-1s are still somewhat expensive in most plans, and employers can't bear the full cost. So what I'm trying to create is how do we create a mechanism out there that we can put, let's say a health plan or an employer puts $100 a month in each of their people that qualifies hands and let them go compete. Let them raise the dollar up in our economic environment. Say, okay, all you GLP-1 developers and providers, I've got $100 to spend. Who wants my $100? And force them to come back and compete rather than the 16 million that are on it today. How about we get as many of the 180 million to almost 200 million Americans today that could utilize the GLP-1, get money in their hands so they can go to the market and now get all these competitors and play on that monetary. I keep saying I'm not totally for monetization, but in this case, let's force them to come back and compete where they don't need to get $300-400 per patient. They can live on 100 if they get tenfold the number. So that's where I'm headed with my thought process and working with our leadership team to try to go down those avenues to get it in, get as much money exposed out there and get it in the patients or the members' hands to get them to go out and force the market to compete to bring the cost down.
That's amazing that you guys are doing that. I didn't know that. That's pretty exciting. I
There.
do want to say, and I'm not an expert by any means, so I want to make sure that I preface any of my comments with that. The research that's out there, ideally, we're changing people's lifestyle habits in time. There's been a lot of benefits from the GLP-1s, not only around obesity, but with other addictions, I guess you would say. They've noticed like a difference with even like smoking and gambling, and then other health benefits too. So whether through weight loss, but then also other impacts like improving folks with cardiovascular risk or even improving with stroke and with dementia. And so there's been lots of studies that have said that the health benefits of taking a GLP-1 have been far reaching, but there still needs to be, I think we don't have the longitudinal studies to say what the long-term effects might be. So that'll be.
They haven't been around long enough to really do long-term study analysis. But what I do know, Shannon, is that I've read thousands of pages on GLP-1s. And one of the things I feel pretty secure with is let's compare them to vaccinations. The repercussion positions against the GLP-1 isn't anything near any of the vaccinations that we've given over the past 40 or 50 years. Yes, there's some pancreatitis. Yes, there's some gallbladder issues. Nothing near what even our smallpox and stuff like that, the vaccinations that are given. So the negative, the positive so outweighs. And like you said, now they're finding out the chemicals in the brain that affects addiction and stuff, that it's the same type of chemicals that are affecting the weight gain stuff that the GLP-1s are affecting. So they've got all these other avenues that they're using it for on the addiction side of things. And it's just crazy how they're finding all kinds of new avenues for it. So I'm trying to temper my excitement, but I keep getting hammered on the other side that it's just amazing.
No, that's awesome. And then to your point about, I was listening to someone the other day and I forget who it was, but they were saying that what it takes to make it compared to what they're charging for is just that it's insane. I don't know. They use something like $3 to make the drug and they're selling it for over $1,000. And so if we could just make it more accessible. So fingers crossed that.
Like I say, if we can get the money in the hands of the 200 million that can use it, I can guarantee you our consumer market will drive prices down.
Yeah, I like that. We've talked about so much today, and I'm really hoping that I'm going to have you back, but we'll get into that in a second. Are there any other things that you want to share, or maybe you were hoping to say today and share with us, or something that came up in our conversation that you wanted to make sure to say that I haven't asked you about yet?
Yeah, the one big thing that and I was just thinking about this, is in this year, this is this year specific, trailed into last year, but I started talking to people about the transition with everything Medicare Advantage. All the plans now have been challenged with MLRs and making their MA programs profitable. And there's a lot of right sizing going on. And what was surprising is how few people knew that some plans were exiting complete market, and they were going to be getting letters not saying this is the new things in your available plans, but we're gone. You're going to have to find a whole new plan. So the communication for our health plans has got to get much better to the members, because waiting for the letters to come out in October to tell them what's going to happen is too late. These people, all of a sudden, I think a lot of people were rushed into decisions. I already talked about how education's bad or making bad decisions already, but then shorten the time frame of them to do any type of research, I think hinders it. So I would like to see plans get more aggressive in their communication with their members. And the next year or two, and a lot of people that I do this with will ask me, what's next for Rod Kersch? What's next for Rod Kersch and the camper guy is it's going to continue. And I think what I did the last 3 years, there is nothing more important than what the future next 2 years. I definitely am going to do it for the next 2 or 3 years to I think the data that's going to come out of that is more important than anything in the past because there's so many changes that occurred. And I think we need to find out how did that affect these members and how do we make sure that we correct it and we right size it. So in 3 or 4 years, we've got a very good product in front of people and they're all down the right avenue of where they need to be. So the next 2 years are very important.
I'm looking forward to hearing what you learn. Would agree with you too on the materials. I think there's an opportunity to bring behavioral science to bear and to really think about educating all the various stakeholders in the healthcare system. So members especially, but others that interact with it as well. I've really enjoyed our conversation today. I'm hoping that you'll come back as a guest and can share more and more stories. I would love to join you sometime and come interview some folks at the campsite. I think the work that you're doing is amazing and applaud you for being out there and speaking with the members and putting them first. And I think that passion, as we shared in before we went live on our recording here, but that passion is really what will help make the difference and improve things for all of us. So I want to thank you for that. Everyone, it's been a fantastic time talking with Rod Kersch, who is Vice President of Health Plan Development at WEC, but also the camper guide. So Ron, thank you so much with us today.
Thank you.